Hi everyone, welcome to our training on oppositional defiant disorder for the schools. I am Mallory Phillips. I work at Access Counseling and I am the middle school coordinator. I currently work at the middle school but remotely due to all of the fun COVID-19 stuff. So I hope this will be very informational for you to kind of rule out whether a kid is just being oppositional or if there's other issues, as well as the best ways to intervene. So the question is what is oppositional defiant disorder? Per the DSM-5, it is a pattern of angry, irritable mood, argumentative or defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms of the following categories, and exhibiting during interaction with at least one individual who is not a sibling. What I also want you to keep in mind is that it is going to potentially happen in more than one setting. So you will typically see this with parents at home. The kids will be angry or irritable, lose their temper, and also at school. Some of the categories include angry and irritable mood, meaning they often lose their temper. They're often touchy or easily annoyed, or they're often angry and resentful. In regards to argumentative or defiant behavior, they often argue with authority figures, or for children and adolescents, with adults. Often, they actively defy and refuse to comply with requests from authority figures or with rules. They deliberately annoy others, and they often blame others for his or her mistakes or behavior. And lastly, vindictiveness. So have they been spiteful or vindictive at least twice in the past 6 months? I feel like this picture is a great representation of all of the different things that we may see in regards to behavior, relationships, and anger. So looking at the anger piece of oppositional defiant disorder, we may see outbursts occurring frequently. They may be very resentful, looking for a reaction from their peers or even adults. They will use inappropriate language. They often want to shock people and upset others. And normally there's no provocation, so it can come out of nowhere. In regards to behavior, you'll notice that they make people uncomfortable. They blow small arguments out of proportion. They can hold grudges. They're going to blame others and not take responsibility for their actions. They don't consider the consequences. They aggravate a situation, often making it much, much worse. They're often argumentative, and they seek out verbal confrontations. I'm sure everyone can identify one kid that they've had that they've ended up in a conflict cycle with. That would be the verbal confrontations. And then relationships. They often have disregard for rules. These are the kids who are intentionally defiant towards you or others. They don't respond well to authority. They're constantly undermining adults, trying to manipulate you to changing your decision. Hostile towards peers. Makes a little attempt to fit in. They may have been neglected or abused. They could have strained relationships with their parents. And there's a possible history of learning difficulties. So how do we know whether a child is exhibiting symptoms of oppositional defiant disorder or another diagnosis? Well, that's where we kind of come in and help. Oftentimes what we will do is we will administer assessment tools that will help us to identify what could be the problem behavior and what's the underlying symptoms. So as we discussed earlier, we have the criteria for oppositional defiant disorder, but I want to also discuss the things that it could also be. Attention deficit hyperactivity disorder, or ADHD as we often know it, has overlapping symptoms such as difficulty following rules, struggling with authority figures, and they may be annoying to others. However, in oppositional defiant disorder, defiance of authority figures occurs beyond the setting where sustained attention or sitting still is required. Often, though, ODD, or oppositional defiant disorder, is comorbid with ADHD, so you may see them both combined. Conduct disorder is another diagnosis that can be ruled out. So the symptoms that are similar is behavioral problems leading to conflict with authority figures. However, where they differ is that more severe behavioral issues occur in conduct disorder, including aggression towards animals and other people, destruction of property, and a pattern of theft or deceit. Anger and irritability are characteristics of ODD, but are not included in the criteria for conduct disorder. Now, we may see people react differently in regards to depression, or even bipolar disorders, struggling with mood regulation. So some of the overlapping symptoms are the irritability or negative affect. However, the argumentative and defiant behavior and vindictiveness that occurs in oppositional defiant disorder does not typically occur in mood disorders, such as depression. Oppositional defiant disorders should not be diagnosed if the oppositional symptoms occur exclusively during a mood disorder. Then we have disruptive mood dysregulation disorder, or DMDD. These individuals mimic symptoms of an individual diagnosed with oppositional defiant disorder because they have a chronic negative mood and often they have temper outbursts. Now, where they differ is that the temper outbursts are much more severe, frequent, and chronic in individuals who are diagnosed with disruptive mood dysregulation disorder. The mood disturbance is severe enough to meet the criteria for DMDD. It often precludes the diagnosis of ODD. Continuing on with additional problems that may mimic oppositional defiant disorder, but are often different diagnoses, could be an intellectual disability. So this is difficulty in school and often has oppositional behavior. However, this is why we need to rule out whether it's in one setting or multiple settings. So with an intellectual disability, it may be detected on formal testing. The person with intellectual disabilities are diagnosed with ODD only if their oppositional behaviors are significantly beyond those that occur in persons with similar intellectual disabilities. So now we're going to be doing some comparison from one individual to another, and you may see this in your classroom as well. Intermittent explosive disorder. So what you're going to see that's very similar to ODD is the anger piece. However, serious aggression towards others does not occur with oppositional defiant disorder. The individual in your classroom may struggle with a language disorder and often be oppositional, and the oppositional behavior really comes from the frustration of not understanding. So the language disorder may be detected on formal testing. Lack of following directions in persons with language disorders is due to the comprehension issues, not defiance. So once again, individuals who are struggling in school may just be frustrated because they don't understand, and it may come off as oppositional or defiant behavior. And lastly, social phobia. So what you're going to see that is similar to ODD is oppositional behavior. However, the opposition in social phobia is due to a fear and anxiety as opposed to the defiance of authority figures that occurs in oppositional defiant disorder. So now we're looking at what oppositional defiant disorder looks like in the classroom. So as teachers and administration, what should you know? Students with oppositional defiant disorder can be so uncooperative and combative that their behavior affects their ability to learn and to get along with classmates and others, especially teachers. It can lead to poor school performance, antisocial behaviors, and poor impulse control. Oppositional defiant disorder is more common in boys than in girls. Signs of oppositional defiant disorder generally develop during the preschool years and are almost always present before the early teens. The behaviors associated with ODD can be mild, moderate, or severe and often include negativity, being argumentative and defiant, disobedient, hostile towards authority figures, temper outbursts, or angry and irritable mood. So kind of recapping on what oppositional defiant disorder may look like in your students. They might lose their temper often arguing with adults, often actively defies or refuses to comply with the adult's requests or rules, often deliberately annoying others, blaming others for his or her mistakes or behavior, often touchy or easily annoyed by others, often angry and resentful, and then despiteful and vindictiveness. So how do we treat oppositional defiant disorder? From a counseling perspective, we can do individual therapy. This helps children to learn to manage their feelings in a more positive and healthy manner. There's social skills groups. So your child will engage in practices that will help them learn to interact more positively with their peers. In-home behavior therapy. This is also called parent management training. There's therapy and support services for children and families in their home. School behavior plans. This is where we kind of come in here with the school. In-school behavior plans for behavior management to help your child improve academically and socially. And then, of course, there's the option of medication. Medication, when combined with behavioral therapies, can often improve the behaviors of oppositional defiant disorder. And I'll kind of teach you some new ways and interventions that can be used in the classroom. So I know working with oppositional children is very difficult, especially in the classroom setting. So how should teachers and parents respond? Recognize and praise the positive behaviors. So not solely focusing on what they're doing wrong or if they're irritating others, but praising the good things they're doing. Avoiding power struggles. If you find that you're getting escalated, take a step back, think it through, and maybe walk away. Setting limits and enforcing consequences. Setting up a routine. Ensure consistent and appropriate discipline procedures. So if you're going to set a limit, you got to stick with it. Learn ways to calm yourself. Take time for yourself and be forgiving. They're still growing. They're going to make mistakes. So now we're going to look at what teachers can do to help students in the classroom. Post classroom rules and review them regularly. Maybe this is something we do in the very beginning, and this can range anywhere from preschool years up through high school. Have a plan in place to handle serious behavior problems. Create connections with the students. A lot of these kids are coming from homes that may not be the most supportive. So create that connection. They may be the targets of bullies or be seen as bullies themselves due to them picking on others. Be sensitive to their self-esteem issues. A lot of individuals struggling with oppositional defiant disorder struggle with their own self-esteem. Provide feedback to your student with oppositional defiant disorder in private, and avoid asking the student to perform difficult tasks in front of the classmates. This may increase a lot of social pressures, and it may make the behaviors worse. And it can be helpful to praise positive behaviors such as staying seated, not calling out, taking turns, and being respectful. So what may the students need? They might need to sit closer to the teacher to avoid disrupting other students. They may need breaks from the classroom when they feel overwhelmed. More time to complete assignments. Consult with a school counselor or a psychologist. Maybe there's some testing that needs to be done. Visit the school nurse to take medications for coexisting conditions, for instance, if they have comorbid ADHD. And an individualized education plan if a learning disability is associated with their ODD. So now we're going to move into the intervention, starting with elementary aged. The first is token economy. What is a token economy? This is an intensive in-class positive reinforcement program for building up and maintaining appropriate classroom performance and behavior. A token program may be needed when other positive reinforcement programs, such as the selective use of teacher attention or a home-based reinforcement program, are not sufficient to motivate the student to behave and perform appropriately. When this is the case, a tangible reward program managed by the teacher may be needed. Now, tangible rewards can be conveniently managed through a token reinforcement program. Token programs involve the distribution of physical tokens, whether they're poker chips, stickers, stars, smiley faces, or points following appropriate behavior. The tokens or points can be accumulated throughout the day in exchange for designated rewards at a specific time. A predetermined goal is set for the number of tokens or points required to earn a reward. The teacher or the classroom aide is responsible for distributing these tokens and providing the reward. Next is an emotional learning skill. So helping the child to identify what are feelings. So assisting a child with ODD to learn about feelings, as this is generally a skill deficit that needs work. So what do? Have the child draw a blank face. Ask him to draw pictures of how he feels when he is angry, happy, and sad. Ask him to talk about more complex feelings, such as jealousy and frustration, since these feelings typically lead to outbursts. Help the child to understand negative feelings are a normal part of life. Help the child to develop the necessary coping skills to deal with those feelings more constructively. I feel like at the elementary age, a lot of kids can relate to the movie Inside Out. So maybe that will be the route you go. And looking at middle school interventions. The first is coping skills for emotions. So dealing with negative feelings does not come naturally to children with ODD. Yelling, acting out, and being negative are learned behaviors that need to be changed in order to help the child become more positive. Learning that coping with disappointments and negativity is a positive thing and can help a child deal more effectively with their feelings. So help the child make a list of all the positive things she likes to do. Write down the list, decorate it, frame it, and keep it where the child can easily access it. Remind the child to put the coping list out whenever she is frustrated and to choose a positive activity over a negative one. Another intervention is conflict resolution skills. So we really want to teach the healthy conflict resolution tips. Getting calm first. Finding a win-win situation, helping them to compromise. Using an I message, saying I feel or I felt before stating what it is that happened. Listen with an open heart. So don't interrupt. Don't have any judgment. Say words that mean no. So using a strong and respectful voice to say that you're not okay with something. Ignoring or walking away. Oftentimes these kids will get into a struggle, a battle with someone, teaching them how to walk away. Share or taking turns. Everyone wins that way. Playing a game of chance, rock, paper, scissors, or flipping a coin. Doing something else. If somebody really wants something another person has, provide them another opportunity to do something different. Asking for help when needed. And then apologizing or saying you're sorry when you make a mistake. In regards to high school aged interventions, managing difficult teens. This is a great worksheet that you can provide to those around you as well as your parents. So talking about rewards and incentives, creativity, how can we foster that? Parent-related issues, looking into their insight, their caregivers' involvement, are mom and dad even in the picture? And then youth who say they don't need treatment. Have them prove it to you. Build that relationship so that you are that one person that they can go to. Refer for services if needed. And then tips for helping parents and teachers. So one of the key things that we have to learn is when to use planned ignoring and when to attend to it. So when we're looking at attending to behaviors, we always attend to the behavior that we want to increase. We need to be specific when using praise so that a child knows the positive behavior he or she did. Make eye contact and smile when attending to the behavior, and use a pleasant voice when attending to the behavior. With planned ignoring, never ignore dangerous behaviors. Ignore the same behavior consistently. So if we're going to ignore an outburst, we have to ignore all of the outbursts. If we're going to ignore them trying to manipulate a situation, we always do that. To ignore the behavior, actively avoid eye contact and turn away from the child. The behavior may initially get worse, which is common. And remember why you are ignoring so that you don't feel guilty and stop prematurely. All of these interventions will help to curb the behavior of the child with ODD. When we focus more on the positive things that they bring to the table opposed to the negative, we'll see some drastic changes. Well, this is the presentation on ODD and how to help children who are diagnosed with oppositional defiant disorder. Please contact me if you have any questions, and I hope this was helpful. Have a great day.